Hello everyone, good afternoon again and welcome to our live video presentation this afternoon. I am Dr. Das from Freeport Medical Center and I'm very happy this afternoon to present to you a topic that a lot of patients and our Facebook friends have been asking us over the many weeks to talk about. So this afternoon we will be speaking about fibroids, and I'm really happy to discuss that topic and to answer some of the questions that some of the patients have been asking. I'd like to say welcome to all our friends on Facebook, all our patients, all our followers who've been following us since we started this educational program 2 months ago. I'd like to say hello also to some of our patients and friends from outside of Trinidad, from New York and Canada, who we see all the time commenting on our Facebook. I'd like to remind everyone as well of our YouTube channel, and to remind everyone that all the presentations that we have had since the beginning of our educational drive are posted on our YouTube channel, and you can get all of these videos and you can view and you can see all these videos at any time. You just have to log into our YouTube channel and you can select whichever one of the presentations videos that you would like to see, and you'll be able to review these videos. So I'm really excited this afternoon. I'd like to start off this afternoon by just answering one important question that one of our patients have posted on the Facebook sometime last week. And this was a patient who actually sustained a fits attack, epileptic attack, and subsequent to that the patient was unable to speak. This has been going on for the past 4 months. I have to tell you that that is a very serious complication of a fits attack, in that when the patient gets a fits attack, remember that the patient is not breathing and the brain is not getting oxygen. You remember when I said, when we spoke about stroke last week, we did mention that the brain needs oxygen and it needs glucose or energy to survive, and the brain can only survive at about 60 to 90 seconds without glucose. So therefore, if a patient sustains a fits attack and this attack goes on for a long period of time, maybe for minutes, then the patient could obviously sustain a stroke, and this stroke can affect your speech center, and hence the reason why the patient is not speaking thereafter. It is a very well-known, documented fact that patients can develop and sustain stroke while they are getting a fits attack. So I like to tell this patient, of course I will not be able to say the name, but I would like you to get a CT scan right away, and you can come in at our CT scan center at Freeport Medical Center here, where we are branded as the CT scan specialists in Trinidad and Tobago. We are performing all types of CT scans, including brain CTs, abdominal, pelvic, lungs, you name it, we do all the CT scan. It's available right away. You do not need an appointment. You just come to us and you get your CT scan, and we guarantee you that the most reasonable and economical prices in Trinidad and Tobago. Our CT scan is functioning, it's working well. We have very great reports, and the reports are available the next day. Very good reports. Okay, all right. I would like to tell you about a patient that I saw today actually. This patient is not very old. She was 44 years of age. She came in to see me because she was very tired, not a very tall person. She was just about 5 feet 4 inches, somewhat little bit overweight, 190 pounds, and she was tired. She was having a period and it was going on for 6 weeks. Heavy bleeding. She was using like about 3 pads for the daytime and sometimes 2 at nights, and this was going on for 6 weeks. The other important point about this is that this lady has been married for 15 years and she does not have any children. Right away, of course, I started to speak to her, and we realized that this was a patient who most likely would have been suffering from fibroids, and which was causing most of her symptoms. As you will see as I go along with the presentation today, you will see that fibroids does in fact one of the causes for infertility. So women who are trying to get pregnant and who has fibroids will find it very difficult to get pregnant. And sometimes too, you can get pregnant, but then you will have a spontaneous miscarriage. So it's very important to note that if you are having heavy periods or if you're having problem getting pregnant, you go to your doctor right away to get this checked out. So basically, a fibroid is what we call a non-malignant or tumor that arises from the smooth muscles of the uterus. Just to understand it a little better, I will just describe the anatomy of the uterus. So let's classify it as the reproductive system. So the reproductive system in females consists of your uterus, the fallopian tubes, and the ovaries. So you have those three structures. The ovaries on both sides. Of course, the reproductive system is located in the pelvis. So you have both ovaries, the tubes, and the uterus. In terms of the uterus is made up of three parts. You have the fundus of the uterus, that's the top of the uterus, the body, and you have the cervix. The cervix is the lower end of the uterus. Now it is a very small organ, and this organ is basically about 8 centimeters in size. So we sometimes refer to it as the size of an orange or the size of a grapefruit, basically. And it generally consists, the uterus is made up mostly, thickened part is the center of the uterus is mostly smooth muscles, and then you have an inner lining, and then you have an outer lining. Alright, the inner lining is known as the endometrium, the middle lining is the myometrium, and the outer lining. Right now, the fibroid, now that you understand the structure of it, the fibroid arises from the myometrium. It is the middle layer, and it's a smooth muscle, and it's a tumor which is benign, meaning that, you know, when we talk about malignant tumors, there's a tumor that spread very fast, they grow very quickly, and they become parasitic. The benign tumors are tumors that remain, they grow very slowly, they're not parasitic, and they're not malignant, they do not cause much harm, basically. So it's a benign tumor, and it can develop from the 3 different areas of the uterus, as I mentioned: the fundus, the body, and the cervix. Okay, now in terms of the fibroid, it can be classified as submucosal, subserosal, cervical, and it can also classified as pedunculate. Pedunculate means that it is attached by a thin string of tissue. It is within the uterus. It could be within the uterus or even within the abdomen, but it's a ball of tissue connected by a string of tissues to the uterus. Alright, submucosal meaning that it's just under the endometrium tissue. Subserosal is the main type, and intramural is the main type, and then you have the subserosal, which is the covering, which is on the outside. Alright, and then you could also have some fibroids arising from the cervix of the uterus. So you have 4 different types of fibroids, and as well as the pedunculate, so that would make it 5 different types of fibroids. And as the fibroid develops, what happens, it grows very slowly, so eventually the uterus, being the size of a orange or grapefruit will eventually start to get bigger and bigger. So as it grows, it gets bigger and bigger, and it then eventually can come out of the pelvis and could even appear to be felt in the abdomen. As this morning I was having a discussion and people were telling me that they can feel the swelling on the abdomen. Yes, of course, once it gets bigger it can go up into the abdomen. Okay. Yes, I would also like to say that in terms of the location, fibroids, as they grow and they get bigger, some of the fibroids can cause different symptoms. So I would like to explain some of the symptoms that the fibroids can cause. First of all, however, just to enlighten you about the epidemiology of fibroids, it's a very, very common condition. Obviously, it occurs mostly over the age of 40, so over 45 you get most of the cases. And in the world statistics, WHO have stated that there are approximately 170 women suffering from fibroids. 170 million women, million. So it's very common, and it occurs. The majority of the cases would after the age of 60 would degenerate and sometimes does not require treatment. However, it is very common in when we compare in terms of ethnicity. It is very more common among the black women as opposed to the colored women. So it's stated in the WHO statistics that fibroids are 3 times more common in black women as opposed to colored women. All right, and other than that, a lot of the fibroids may require surgery because it can cause lots of problems. All right, so in terms of the way patients present to the doctor, when patients come to us, it causes a number of symptoms. Remember that the uterus, the main function of the uterus is for reproduction in the females, so it is important for the monthly menstrual cycles. So the uterus changes as the cycles go during the different phases, the men's phases, etc. And as that will be for the one function, the menstrual cycles, and also the other main function of the uterus is for reproduction. All right, so those are the 2 main functions. So then if we to look at it in that regard, we can say that it will, of course, because it's interfering with the anatomy of the uterus, it will create problems with reproduction. So that's one of the problems. But the main problem that patients come to us would be for heavy bleeding. That's with the menstrual cycle, so they come to us for heavy bleeding. Usually a period will last between 5 to 7 days. Sometimes some patient period goes on for 10 days, 12 days. But what is more important is that the bleeding is heavy. So patients come to us because of heavy periods. They may also have painful periods. So it is heavy and it's also painful. As well as, when I say heavy periods, they will also have yes. Oh, excellent. I'm seeing here, I'm seeing a nice flashing light coming on here. There's a patient who's logged on from Pakistan, Abra Ali. Hello, Abra. It's so nice to see our followers from all over the world, and I see we also have one from Canada as well too, and Abra is from Pakistan. Hello, Tina. Tina is also logging on. Right, very good. Abra is asking, Tina is asking, can fibroids turn into cancer? And that's a very good question. I will answer it right away. Um, it's most of the time fibroid is benign. However, in I don't want to say few, but in one in probably 5,000 cases, it can change to become malignant. It can become cancerous. So it's very important to treat these things and see a doctor as soon as these things arise, because sometimes it can become cancerous. As I said, few, but 1 in 5,000 is still one patient will become cancerous. So it has to be treated. Okay, so yes, it can become cancerous, but very, very, very minimally. All right. So I was talking about the symptoms. So heavy painful periods. Patients come to us because of loss of blood, so they start to become anemic, so they start developing tiredness, weakness, lethargy, listless. Patients don't have energy at all. Then, because the fibroid is located in the pelvis and is pressing on the bladder, you find that you want to go to the bathroom to pass urine often, and sometimes it may even block the rectum to the back posteriorly, causing constipation. In some cases, the fibroid may even rest on the nerves in the pelvis or irritate the nerves, and patients may even get pain down their legs, or they can get back pain as well too from fibroids. Alright, patients also, as we mentioned before, infertility, difficulty getting pregnant. And a very important patient I saw even last week as well, I was performing a pap smear, and this patient complain about painful intercourse. So you have pain with intercourse. Patients are unable to have intercourse and things like that. Alright, so it's very, 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 very a serious problem. Remember, it continues to grow. It grows very slowly, but it continues to grow. Alright, who are the patients who will get fibroids? Well, most important to understand is fibroids grow because of the female hormones, estrogen and progesterone. So the fibroid will grow until a patient reaches menopause, and once this patient reaches menopause, the fibroid will then start to degenerate. Alright, so most times it would be patients above 40 to menopause age. So usually all women above 40 have to be careful and check. And then if patients who have started their periods at an early age, which means that their body will be exposed to estrogen and progesterone from an early age. So if you started your period before 10 or around 10, as opposed to a person who started their period at 16, this person will be more likely to get a fibroid. Okay, a patient who does not have any children is more likely to have to get a fibroid, who doesn't have children. And of course, if you have fibroid, that will also prevent you from getting pregnant. So that goes hand in hand, right? A person who use contraceptive from an early age may not get fibroid, because they would have regulated their cycles and the estrogen levels would have been lower. So if you use a low dose contraceptive pill, you would prevent yourself from getting fibroids. Alright, then they talk about other things like obese patients are more likely to get it, which I don't think is a very strong point. But also there is a slight familial and genetic predisposition, so that patients whose families, like mothers and sisters, aunts who have had fibroids, will also more likely to get fibroids. Okay. Alright, I see Cheryl Kumar is asking, keep up the good work. She's commenting. Okay, Sadi is also commenting. Hello Sadi, hello Cheryl. Okay, very good. Good day to everyone. Alright, so once a patient comes to the doctor for fibroid, a diagnosis has to be made, and this diagnosis is made by the doctor. If you have these symptoms, go to a doctor. Most of the times the diagnosis is made by an examination. The doctor will examine the patient. He will feel that the womb is larger than what it's supposed to be, Once it's larger, you will also do other tests like blood tests, check for the blood count. He will also check the blood group. He will then order an ultrasound test, which is the gold standard test for checking for fibroids. An ultrasound test must be done, and this is the test that will diagnose a fibroid. Alright, it will also tell you the location and the size. If it's intramural, if it's subserosal, submucosal, if it's in the cervix, or if it's pedunculate. Sometimes you can also tell with the ultrasound test. Okay, and once a diagnosis is made, then the patient treatment plan is made. Now, the important thing about treatment here is to really decide if the patient wants to have a baby, if the patient wants to get pregnant. So fertility is the key point that we consider as doctors. And if a patient does not have any children or wants to have more children, that is the main factor that really dictates how we treat patients with fibroids. The mainstay of treatment with fibroids really is basically to control the patient's bleeding, and in most cases is to either take out the fibroid, or in some cases to take off the entire womb. Alright, and what we do is if a patient, so the treatment is divided into two: patients who already finished their families and who are close to menopause. Say like you're 49, your menopause, say we predict that menopause will be at 50, and you're 49. That's one way we treat patients, and one method of treatment. And patients who are, say like you're 32, you don't have any children, and you want to have children, then we'll have to do what we call a conservative treatment. In conservative treatment, what we do is we give patient medication to rebuild their blood. First of all, to build back your blood count. We also give patient medication to stop the bleeding. So we put them on hormone tablets to try to stop the bleeding, and sometimes we even put them on low dose contraceptive pills to get them to their hormone levels to drop and to control the bleeding. Sometimes there is a progesterone medication that we can use as well to stop the bleeding. If the fibroid is submucosal, which in other words is it is invading the uterine cavity, then sometimes you may have to do surgery, because that is interfering with the implantation of the fetus, but the placenta cannot attach to the uterus, and therefore you may need surgery to take out the fibroid. Alright, in that case, patients will need to do a surgery called a myomectomy. A myomectomy can be done through a laparoscope. Now, a lot of medical things here, but basically it means you're doing a small incision through the abdomen with a camera. You're not doing an open surgery. You're passing the camera and the surgical instruments through there and doing a fine surgery. The risk here is bleeding, of course, because the uterus is very vascular. There are lots of blood vessels on the uterus, and these blood vessels come from the aorta directly via we have the two blood supplies, one we call the uterine artery and another called the ovarian artery. The ovarian artery comes directly from the aorta, and the uterine artery comes from a branch from the internal arteries of the pelvis. Alright, so you have different blood supplies, but the blood to the uterus is very vascular, because as you know, you have a monthly cycle where blood is going to the uterus, and you're losing blood, so therefore there's a rich blood supply. Alright, so you do a myomectomy in cases of people who want to retain the ability to have children. Sometimes, in some cases, you can do what we call uterine embolization, uterine artery embolization, where you pass a fine catheter into the blood vessel, and this is done by a radiologist, interventional radiologist, who pass a catheter through the vein to the artery, and it goes to the uterine artery, and then you can block the blood supply that goes to the fibroid, causing the fibroid to degenerate and get smaller. So that's embolization. Alright, there are some new research coming about which said that you can also use gonadotropin releasing hormone blockage to prevent the hormones from being released into the blood to cause the fibroid to grow. So that's the new method of treatment. I don't believe that it's utilized here in our country. So most of the times we'll use myomectomies, and sometimes we also use open surgery, where you do the surgery from above the pelvis in the abdomen. Alright. If a patient is close to menopause, we use conservative treatment, try to stop the bleeding. We give them some non-steroidal anti-inflammatory drugs to slow down the bleeding, and once the bleeding slows down, to help with the pain, and we give them the progesterone tablets and sometimes progesterone inserts, etc., to help with the bleeding. If you do the ultrasound now and there are quite a bit of fibroids, the patient has finished their family, they don't want any more children, the patient is like 40, have 10 more years before menopause, obviously this patient cannot take on this problem for that long length of period. We recommend a hysterectomy. Hysterectomy is where you take off the entire womb. It is done via open surgery. It's quicker process, it's faster. Of course, some surgeons can also use what we call laparoscopic hysterectomies, and this is where you again use the camera and the surgical instruments to do the surgery. But again, remember the complication of bleeding. The patient can bleed, and then you still have to resort to opening the abdomen to solve the bleeding problem. Alright, so those are the mainstays of treatment for fibroids. Remember that there is always a very minimal chance of these things changing and becoming cancerous and malignant, and we have to really treat them as soon as it has been diagnosed. Alright, other than that, patients who are close to menopause, we allow them, we watch them, we try to treat them with tablets until they reach their menopause. Of course, all of these patients must get a pap smear to ensure that there is no problem with the cervix, because pap smears is the screening test for cervical cancer, as we have mentioned before in one of our previous videos. Alright, I see Tina is asking here again. Hello Tina, what complications can occur with fibroids? As I explained before, patients can have problems with constipation, frequent urination, painful intercourse, difficulty getting pregnant, and sometimes when you get pregnant you have repeated miscarriages, heavy bleeding, patients become anemic, they may need blood transfusion. There's lots and so many complications. If the patient becomes very anemic, patient can go into heart failure, they can go into shock. So you have to treat these problems quickly. Alright, so fibroid is a very, very, very common problem, as I've mentioned before. 170 million women suffer with fibroids worldwide. It has to be diagnosed with an ultrasound scan that is done at Freeport Medical Center. This treatment, we have one of our specialists here who does embolization, and patients can come to us and we can put them on to this doctor who does uterine embolization. It is one of the new techniques in treating fibroids. Sometimes you may have to do CT scan. Remember, we are the CT scan specialists in Trinidad and Tobago. All our CTs reports are available the next day, and patients can get the CTs right here also. Alright, so I would like to wrap up here by thanking everyone for viewing, and please keep on posting your questions. And as you can see, we are very quick, we respond to your questions very quickly. Any advice that you want that can be given via Facebook, we will do that. Of course, we will not go into too much specific details of treatment, and diagnosis cannot be made via Facebook and telephone, etc. Alright, I'd like to thank everyone for viewing, and we'd like to invite you all for our next presentation next week. We have decided to speak about arthritis. That is a long topic. I would probably have to do that in 2 sessions, but next week we will decide. So arthritis is going to be our next discussion next time. I'd like to thank everyone again, all our friends. Hello again to our friends from Pakistan, from Canada, from New York, all our patients from Trinidad who have been logging on. In fact, we have made a record. We have had 36,000 persons seeing our video for this last presentation on stroke. I must say it has been a very, very, very interesting topic. People have been very interested in it. So thank you all again, and see you all. Bye bye until next time. Bye bye.